Here hypertension is nothing but if there is any increased blood pressure. So the pressure which is exerted by the blood in the blood vessels is called as blood pressure. So if the blood pressure is increased than its normal, then it's called as hypertension. So the normal blood pressure is about 120 to 80 mm of Hg, where 120 mm of Hg represents the systolic blood pressure and 80 mm of Hg represents the diastolic blood pressure. So if the systolic blood pressure is greater than 140 mm Hg and if diastolic blood pressure is greater than 90 mm of Hg, then it leads to a condition called as hypertension. So here this hypertension is normally measured with an instrument called as sphygmomanometer, and if the pressure inside the blood vessel is increased, then it leads to this hypertensive condition. So here in the blood vessels we have arteries and veins. So the pressure which is created inside the arteries is called as arterial blood pressure, and the character or the features or the factors which are influencing this arterial blood pressure are the cardiac output as well as the stroke volume. So here the arterial blood pressure is the multiplication of both cardiac output as well as systemic volume. Here the cardiac output is nothing but the amount of blood which is pumped out of the heart within a minute. So this cardiac output and systemic vascular resistance determine the arterial blood pressure, and the cardiac output is the result of stroke volume and heart rate. So here the number of beats per minute as well as the stroke volume determines the cardiac output. So these are the main factors which are involved in the hypertensive conditions. And here we can see the factors which are influencing the cardiac output as well as the cardiac output. So here the factor cardiac output is a multiplication of both heart rate and stroke volume. So here let us see the factors which are influencing the heart rate. Here the autonomic innervation, that is the sympathomimetic activity, as well as the hormones, the hormonal fluctuations, or if there is any increase or decrease in the hormonal levels, and fitness levels. If a person is not fit or not physically, not doing exercise on regular basis, and age. These are all the factors which determine the heart rate, and the factors affecting the stroke volume are the heart size. The size of the heart determines the stroke volume. Fitness levels again, the gender, and the contractility of the heart. So how, what is the contraction capacity of the heart, as well as the duration of contraction, how long the heart is in the contracted state, and in the preload state and afterload. So these all factors determine the cardiac output. Let us see the modulators of cardiac output. So here we have the total body sodium content as well as the contractility of the heart. So here if the sodium retention is taking place in the body, or if the sodium is in more concentration, then the sodium will enter into the cell, leading to the depolarization of the cell, and the action potential is generated. So because of that, the cardiac output can be increased. So here the sodium content determines the cardiac output and heart rate. And here if we see the contractility of the heart, so if the contraction capacity of the heart is increased, or if the heart is contracting, then it's normal, then it leads to increased cardiac output. So here these two contents are to be modulated or regulated in order to maintain the constant cardiac output. Let us see the modulators which are affecting the systemic vascular resistance. So there are various factors like humoral factors and the local factors. In the humoral factors, there are the vasoconstrictors. These are the chemical agents which constrict the blood vessels, and there are vasodilators which dilate the blood vessels. So the vasoconstrictors like angiotensin 2, norepinephrine, thromboxane, and endothelin, and the vasodilators like prostaglandin, bradykinin, and ANP. And local factors like vasoconstrictors like myogenic response, and the prostaglandins, leukotrienes, and endothelial contracting factor, and aubain-like factor. So the aubain is a naturally occurring plant alkaloid. So these are all the chemical responses or the chemical mediators which aid in the constriction of the blood vessel. And if we see vasodilators, endothelial relaxing factor and endothelial ion channels. So these aid in the relaxation or the dilatation of the blood vessels. Now, let us see the mechanisms which regulate the blood pressure. So here there are various mechanisms by which the blood pressure can be increased or decreased. First thing is the sympathetic nervous system. So in the sympathetic nervous system, we have various sympathetic or adrenergic receptors like alpha and beta receptors. So here the chemical mediators or the neurotransmitters in the sympathetic nervous system are adrenaline and noradrenaline. So if adrenaline binds to these sympathetic receptors, then it aids in the contraction of the heart and contraction of the blood vessels, and thereby the heart rate and force of contraction are increased. So the sympathetic nervous system has to be regulated in order to maintain the blood pressure. And vascular endothelium. So vascular endothelium, from this vascular endothelium, the substance called NO, nitrous oxide, is released. So this nitrous oxide, it aids in the conversion of ATP to cyclic AMP, where if cyclic AMP levels are increased, there occurs the relaxation and dilatation of the blood vessel. And renal system. So in the renal system, renin is the mediator which is releasing the angiotensin. So this angiotensin, it constricts the blood vessels, and that is the reason the renin angiotensin system has to be maintained. And the other one is endocrine system. So hormonal levels also fluctuate, or as they aid in the increase or decrease of the blood pressure. Let us see the diagnosis of hypertension. So the diagnosis tests which are involved in the to recognize the hypertension are the routine tests, normal tests like ECG, electrocardiogram, and then urine analysis of the patient to be taken in order to observe whether the proteins, plasma proteins, are excreted in the urine. And the other one is blood glucose level, and serum ionic concentrations like sodium, potassium and calcium are to be regulated, and even the glomerular filtration rate has to be determined, and the lipid profile of the person and eye examination have to be made. These are the routine tests. And the optional tests in the severe conditions of the hypertension, the test like X-ray, chest X-ray has to be taken, and for every 24 hours the urine analysis have to be done in order to see or in order to observe whether the albumin is excreted in the urine. Let us see the types of hypertension. There are two types of hypertension: primary or essential hypertension and secondary hypertension. So primary hypertension or essential hypertension is a hypertension which is of unknown cause, in the sense the cause is not known exactly, and this is caused, in this type of hypertension, the blood pressure may be regulated by various mechanisms. And if you see secondary hypertension is caused in addition to various diseases. For example, if a person is having diabetes, then there will be increased blood pressure. So hypertension is an addition cause of the diabetes. So this is of secondary hypertension, and there are various factors which are influencing the hypertension, like stress. So if the stress increases, the blood pressure increase, and if sodium uptake increases, then the blood pressure will increase. And obese, if a person is obese, then also because of the constriction of blood vessels, there occurs increased blood pressure. And smoking habits, so sedentary lifestyle also leads to increased hypertension. Let us see what are the risk factors which are involved in the primary hypertension based on age. As the age increase, the blood pressure may increase, and if a person is having sedentary lifestyle like consuming alcohol and smoking, that may lead to increased hypertension. And diabetes mellitus and elevated serum levels. So if the lipid profile is more, then the person is more prone to hypertension. And if there is any sodium excessive diet, so if a person is taking sodium in the diet in excess amount, then it leads to sodium retention. And gender and even family history, it's a hereditary, and based on the obesity of the person. If a person is more obese, then he is more prone to blood pressure and sedentary lifestyle and socio-economic factors and stress. So all these leads to all these conditions are prone to hypertension. Let us see what are the causes of hypertension. So why this hypertension is caused. So if a person is having chronic kidney diseases, or if there is any renal failure, then it causes hypertension. And coarctation of the heart, in the sense the constriction of the heart or the contracted state of the aorta for a longer period of time. And Cushing's syndrome and drug induced, few drugs have the side effect of hypertension, and obstructive uropathy and pheochromocytoma. This is a condition that is this is a rare condition of inflammation of adrenal gland of kidney. And hyperaldosteronism, if the aldosterone hormone is released in excessive amount. And renovascular hypotension, that is stenosis of the vasculature of heart. And sleep and thyroid and parathyroid diseases. So all these lead to the hypertension conditions. Now let us see the treatment which is involved in the hypertension. First thing is that the non-pharmacological approaches. First thing, we have to make ourselves fit. We have to do regular exercises on regular basis. And the other one is we have to maintain our diet. We have to take care of diet. And the other one is we have to do physical activities. And the sodium intake in the diet has to be maintained, and even we have to maintain the potassium also in our diet. And let us see the pharmacological approaches, that is the drugs which are used in the treatment of hypertension. So there are various drugs like diuretics, beta blockers, angiotensin converting enzyme inhibitors, angiotensin 2 receptor inhibitors, beta plus alpha blockers. These are mixed sympathomimetic drugs, sympatholytic drugs, and central sympatholytics and vasodilators. So here if we see, we have to maintain our body weight according to the body mass index. So according to our BMR, the weight of the person should be maintained, and even we have to maintain our eating habits also. We have to take proper diet, and we have to reduce the sodium and potassium in the diet. Physical activity on regular basis is important, and the alcohol and smoking habits have to be withdrawn in order to prevent the hypertensive conditions. So let us see the classification of antihypertensive drugs. The first category are diuretics. In these diuretics, the diuretics like thiazide diuretics, high saline diuretics, and potassium sparing diuretics are used as antihypertensive drugs. Hydrochlorothiazide and chlorthalidone, these are the thiazide diuretics. And high saline diuretics like furosemide, and potassium sparing diuretics like spironolactone, triamterene, and amiloride. So these are the drugs which are used as antihypertensive. So these drugs, they act mainly by inhibiting the retention of sodium and water. So if we take excessive water and sodium in our diet, the sodium and water gets retented. They get reabsorbed and retention takes place. So this excessive sodium and water has to be eliminated out of the body in order to reduce the blood pressure. So these drugs, they eliminate the sodium and water out of the body. And if we see, this is the diagrammatic representation. Here the thiazides act at the distal convoluted tubule, and this furosemide, that is high saline diuretic, it is acting at the ascending loop of Henle, and these lactones and all, they act at the proximal convoluted tubule. So these diuretics, they act at various parts of the nephron, and thereby they prevent the reabsorption of sodium and water, and thus these are excreted out of the body, and thereby the blood pressure is decreased. The other category are the angiotensin converting enzymes. So here angiotensin converting enzyme. So angiotensin is a substance, or angiotensinogen is a chemical product which is released from the kidney. So here, renin is the substance which is released from the kidney. So here renin converts angiotensinogen to angiotensin 1, and angiotensin 1 is converted to angiotensin 2. Here the enzyme which is involved in the conversion of angiotensin 1 to angiotensin 2 is called as angiotensin converting enzyme. So here this enzyme has to be inhibited because angiotensin 2 is a potent vasoconstrictor. So if constriction of the blood vessel takes place, it leads to increase in the blood pressure. So here the drugs which come under this category are captopril, enalapril, lisinopril, ramipril, fosinopril. These drugs inhibit the conversion of angiotensin 1 to angiotensin 2. The other one is angiotensin blockers. So AT1, angiotensin 1 blockers. These are the drugs which block or they prevent the angiotensin to bind to this AT1 receptors. So thereby it will not exert the action of vasoconstriction. The drugs which come under this category are losartan, candisatin, valsartan, and telmisartan. So here if we see, the angiotensinogen is converted to angiotensin 1 by renin, and angiotensin 1 is converted to angiotensin 2 by angiotensin converting enzyme. So here this angiotensin 2, it binds to either 81 receptors or 82 receptors. So here once it binds to 81 receptors, it shows the vasoconstriction action. So here this angiotensin receptor or 81 blockers, they don't allow the angiotensin 2 to bind to the 81 receptors, and thereby they decrease the blood pressure. The other one is calcium channel activators. The drugs which come under this category are diazoxide, minoxidil, pinacidil and nicorandil. So these potassium also plays a major important role in the increase of the blood pressure. Here the potassium which is there, once it's enter into the cell, it causes hyperpolarization of the smooth muscle. So once the smooth muscle hyperpolarization takes place, that leads to increased blood pressure. So this hyperpolarization of the cell has to be prevented in order to relax the smooth muscle. So here potassium channel openers, they allow the entry of potassium into the cell, and thereby potassium efflux is increased. So if potassium efflux is increased, that causes hyperpolarization of the cell. So once the once the membrane or the cell reaches to the hyperpolarization state, it leads to the calcium, and it leads to the elimination of calcium out of the cell. In the sense, in the cell or in the cytoplasm, the calcium levels are decreased. So if calcium levels are decreased, then the depolarization of the cell is prevented. So if the depolarization of the cell is not taking place, then it leads to the relaxation of the smooth muscle. Vasodilators. So here there are atrial vasodilators and atrioventricular vasodilators. So atrial vasodilators are those which cause dilatation of the vascular smooth muscles of arteries. So here the drugs which come under this category are hydralazine, and atrioventricular drugs include sodium nitroprusside. Here we can see from the endothelium of the cell, the NO, that is nitrous oxide, is released. So this nitrous oxide, it converts ATP to cyclic AMP. If the cyclic AMP levels are increased, it leads to the relaxation of the smooth muscle. So here if the arteries are relaxed, then the drugs like which relax the arteries are hydralazine and sodium nitroprusside. It relaxes or it dilates both arteries and ventricles. The other class of drugs are calcium channel blockers. So calcium channel blockers, these calcium channel blockers are further divided into phenylalkylamines, benzothiazepines and dihydropyridines. So the drug which come under this category of phenylalkylamines is verapamil, and benzothiazepines include drugs like diltiazem, and dihydropyridines are further classified into first generation, second generation and third generation drugs. So the drugs which include first generation are nifedipine, and second generation drugs include istradipine, nicardipine and felodipine, and third generation drug include amlodipine. If we see the mechanism of action, here the benzodiazepines or the calcium channel blockers, especially the drugs like benzothiazepines, phenylalkylamines and dihydropyridines, they won't allow the calcium to enter into the cell. So if the calcium is entering into the cell, it causes depolarization of the cell, leading to the increased muscular tone, and thereby the blood pressure increases. So here they block the entry of calcium into the cell, preventing the depolarization of the cell. The other class of drugs are beta blocking drugs. Here we have non-selective drugs and selective drugs. So here in the beta blocking agents, there are three types of beta receptors: beta 1, beta 2 as well as beta 3 receptors. So non-selective drugs, they can bind to any of the three beta receptors, whereas selective drugs which are cardioselective, that is beta 2 blockers, they especially bind to the beta 2 receptors and exert their action, and these beta 2 receptors are present in the cardiac muscle. Non-selective drugs include drugs like propranolol, nadolol, timolol, pindolol and nabitolol, and cardioselective drugs include metoprolol, etinolol, esmolol and bitoxolol. There are specific alpha 1 receptors. So there are alpha and beta receptors. So alpha receptors are of two types, alpha 1 and alpha 2. Specifically here, alpha 1 receptor antagonists are preferred as antihypertensives. The drugs which come under this category are prazosin, terazosin and doxazosin. There are central sympatholytics. So these show sympatholytic or anti-adrenergic action centrally. The drug include methyl dopa and clonidine. Here if we see the mechanism of action of these sympatholytic drugs, here we have alpha 1, alpha 2 and beta receptors. So here this adrenaline and noradrenaline are the neurotransmitters which are present in the sympathetic nervous system. So if these adrenaline or noradrenaline, they bind to alpha and beta receptors, they cause stimulation of the sympathetic nervous system, and thereby one of the function is that they increase the blood pressure by increasing the vascular smooth muscle tone. So here the alpha 1 receptors, they follow the they decrease the blood pressure by following IP3 and DAG pathway. So here IP3 is inositol triphosphate pathway and DAG is diacylglycerol pathway. So here they aid in the conversion of ATP to cyclic AMP, whereby the calcium entry is decreased and causes they prevent the depolarization of the cell, and thereby the smooth muscle contraction is decreased. And in the same way, the beta receptor also, the beta adrenergic blockers, they won't allow the adrenaline to bind to the receptors, and thereby they prevent the contraction of the smooth muscle. Now let us see RAS system. So renin-angiotensin system. So here renin is an enzyme, or else we can say renin is a proteolytic enzyme which is also called as angiotensinogen. So here this renin, it converts angiotensinogen to angiotensin 1, and here the renin is produced from the juxtaglomerular cells of the kidney. From the juxtaglomerular apparatus of the kidney, this renin is secreted because of the decreased blood pressure and because of the sodium content which is present in the kidney and increased sympathetic nervous activity. So if there is any decreased sodium, if there is any decreased atrial blood pressure and increased sympathetic nervous system activity, then it leads to the release of renin. This renin, it aids in the conversion of angiotensinogen inactive form to active angiotensin 1, and angiotensin 1 is converted to angiotensin 2 in the presence of angiotensin converting enzyme. So angiotensin 2 is a potent vasoconstrictor, and if we inhibit this angiotensin 2, thereby vasodilatation takes place. And further, this angiotensin 2 is getting degraded. It degrades by the enzymes of peptidases, and thereby it is forming angiotensin 3. Here is the pictorial representation of RAS system. From the liver, angiotensinogen is released, and from the kidney, renin is released, and thereby angiotensinogen is converted to angiotensin 1 and 2, and finally it shows various effects on the body. Now let us see what are the effects of all these drugs. So first class of drugs are diuretics. So diuretics show fluid depletion. So they deplete the fluid and they excrete or else they eliminate the sodium and water, or they eliminate the sodium and excessive fluid out of the body, and they improve they improve congestive heart failure effects, and they show systolic functions, and they are calcium saving, and they have side effects like they secrete even potassium also. They eliminate even potassium out of the body, and uric acid levels are increased, and it will increase the calcium levels if they are used in excessive dose, and even the lipid profile is also increased, and it causes torsade D points. So torsade D points is a condition which is affected with the rhythm of the heart. So here this is a triple response which is created because of the impulses generated in the heart. And these diuretics should be contraindicated in gout because these diuretics, they increase the uric acid levels. So gout is a condition where the uric acid crystals are getting deposited in place of synovial fluid. So if increased uric acid crystals, if the uric acid levels are increased, then it may worsen the condition of gout, and they are contraindicated in hypokalemia condition, because these diuretics, they eliminate potassium. So in hypokalemia condition, if the potassium levels, if these diuretics are given, then the potassium levels can be decreased more, and they should not they are strictly contraindicated in dyslipidemia condition and uncontrollable diabetes mellitus and even erectile dysfunction. So in all these conditions, these drugs are to be contraindicated. The other class of drugs are beta blockers. So beta blockers exert their actions like they show decreased heart rate, decreased force of contraction of heart, decreased conduction of impulses in the heart, and decreased myocardium. So decreased myocardial oxygen demand. So here the oxygen demand, or as the oxygen which is supplying, the oxygen supply to the heart can be increased, or else oxygen demand can be decreased, and it improves the ischemia conditions. So the damage to the heart can be improved, and congestive heart failure and migraine conditions can also be improved. And they show side effects like they decrease the work capacity. So if they are acting for longer period of time, then the particular organ work capacity, or else the ability of the organ to work can be decreased, and it causes fatigue or tiredness, and it may lead to loss of libido. The person won't be socialized, and it may have nightmares. The person will have nightmares, and it causes decreased triglyceride levels also, and thereby the LDL and HDL, it causes increased triglyceride levels, and thereby the LDL and HDL ratio can be increased. Here the HDL levels are decreased, whereas LDL levels are increased, leading to the severe consequences of obesity. And it should be contraindicated in bradycardia condition. Bradycardia is a condition where there will be decreased heart rate, and Prinzmetal angina, COPD, that is coronary obstructive pulmonary disorder, dyslipidemia conditions, pheochromocytoma, in smokers, and if old hypertensives, in the sense people who have already taken medication for hypertensives. In these conditions, the beta blocking agents have to be strictly contraindicated. The other class of drugs are alpha blockers. Especially the drug which is clinically useful is prazosin. So it improves the cardiac metabolism, and it is used for diabetes, but it is not it's not preferably to given in neuropathic condition, and it decreases the LDL and triglyceride levels, whereas it increases the HDL levels. And it shows the common side effects like headache, drowsiness, dry mouth, weakness, palpitations, there will be fluctuations in the pulse, and blurred vision, the person can't see properly, and fluid retention will be there, and postural hypotension. And these alpha blockers are strictly contraindicated. Especially this prazosin should not be combinedly given with terazosin and doxazosin. So these two are also alpha blocking agents, but these should not be given with these drugs, and that may lead to stroke. So if prazosin is combined with terazosin or doxazosin, it may severe the condition of stroke. The other class of drugs are calcium channel blockers. So these calcium channel blockers show effects like they are quick in showing their action, and they do not cause any sedation. So when compared to other drugs, they do not cause any sedation, and they show anti-arrhythmic activity, because the drug called verapamil, which is a phenylalkylamine drug of calcium channel blockers, it is a very good anti-arrhythmic. It shows very good anti-arrhythmic activity, and the lipid profile is maintained to the normal by this drug, and it is used in vasospastic angina. And the side effects include it causes fluid retention, and it may worsen the condition of congestive heart failure, and it may causes gastroesophageal reflux. Whatever the gastric contents are there, that gets regurgitated, or they comes back into the esophagus, leading to the esophagus ulcers, and ankle edema if there is any swelling in the ankle, and difficulty in bladder voiding. If there is any difficulty to empty the bladder in that condition, this may be the side effect of these calcium channel blockers. And it should be contraindicated in tachycardia condition, that is increased force of contraction of heart, and in arrhythmia condition, and in congestive heart failure, and if there is any overload which is increased with the beta blockers, in these conditions the calcium channel blockers are contraindicated. The other class of drugs are ACE, angiotensin converting enzyme inhibitors. So these, when administered into the body, they show actions like they retard diabetic neuropathy. So in the neuropathy is the consequence of diabetes mellitus. So they retard the neuropathic condition, and they even regress, or they even decrease the ventricular hypertrophy in the left ventricle, and they cause no sedation, and they leads to hypotension condition, and they even does not, or else they decrease the aldosteronism condition, and even they decrease the calcium over calcium entry into the cell, and they have side effects like bradykinin accumulation. So bradykinin is a neurotransmitter. Bradykinin is a chemical mediator which causes allergic reactions. So it causes bradykinin accumulation, and it increases the serum potassium levels, and it even decreases the glomerular filtration rate, and this should be contraindicated in pregnant women, and even it should be contraindicated in artery stenosis. So if there is any stenosis to the heart, or if there is any angioedema, if there is any inflammation caused to the heart because of the drugs like NSAIDs and antacids, so these should be contraindicated in these conditions. And the other class of drugs are angiotensin 2 receptor inhibitors. So they show effects like they prevent the stroke. So they prevent the occurrence of the stroke, and they are even used in the systemic hypertension for elderly patients, and they have side effects like if they are if they are used in longer period of time, then they cause hypotension, hyperkalemia, they will increase the potassium levels, headache, dizziness, and they may have upper GI problems. There will be GI disturbances, and they should be contraindicated in pregnant women. The other class of drugs are central sympatholytics. So central sympatholytics, they decrease the noradrenaline level. So if this noradrenaline binds to the adrenergic receptors, then it shows the increased contraction of the heart. So they prevent the noradrenaline levels, or they decrease the noradrenaline levels. And they have side effects like sedation, mental depression, dry mouth, constipation, fluid retention, hypotension. It may cause impotence also, and bradycardia and posterior hypotension. And these should be contraindicated with tricyclic antidepressants. So they should not be given with these drugs in depression condition, and chlorpromazone, because this may even, if these central sympatholytics, if they are given with these drugs, then these central sympatholytic action will be abolished, or we can say these drugs cannot show any antihypertensive effect. So that is the reason they should not be given with these drugs. The other class of drugs are vasodilators. They directly act by dilating the vascular blood vessel, and they have the side effects like angina, and they cause myocardial infarction. They cause lupus erythematosus. So this is a condition where there will be improper functioning of the red blood cells, and rheumatoid arthritis, fluid retention, edema, and there will be flushing, and even there will be the nasal stiffness. There will be improper mucus secretion, and thereby it should be contraindicated in old patients. In the elderly patients, it should be contraindicated, and even if a patient who are suffering with ischemic heart disease, so if a patient is having cardiovascular related disorders, then these vasodilators are not recommended. Let us see the treatment of hypertension. So how the treatment is given. So while giving the treatment, we have to consider a few factors like heart failure. So if a person is having heart failure or not, and if a person is having coronary artery disease, myocardial infarction, stroke, diabetes, and chronic renal failure. So these are all the complications, these are all the diseases which are leading to the hypertensive condition. So we have to make consideration of all these diseases before giving the treatment of hypertension. And The combination therapy is more effective when compared to the individual therapy. So the combination therapy with the drugs like sympathetic inhibitors except beta blockers. So here alpha blockers and vasodilators and when combined with the diuretic effect show better action. And the drugs like diuretics and CCB, that is the calcium channel blockers and angiotensin converting enzyme inhibitors and vasodilators can be given with the beta blockers because they block the renin release. And this hydrolysine and calcium channel blockers can be combined with beta blockers, and the drugs like angiotensin converting enzyme inhibitors can be given with diuretics. So these combinations are very effective in treating hypertension. So here the three drug combination. Till now we saw 2 drug combination. So 3 drug combinations are also preferred to show better hypertensive activity or to treat hypertension. So drugs like calcium channel inhibitors plus angiotensin converting enzyme inhibitors or angiotensin receptor blockers plus diuretics. So these 3 combinations are very good combinations, and calcium channel blockers with beta blockers and diuretics are preferred, and angiotensin converting enzyme inhibitors with angiotensin receptor blockers along with the beta blockers and diuretics are preferred. Now, what are the drugs, or else we can say what are the contraindications? What drugs are to be never combined? So here alpha and beta blockers should not be combined with clonidine because it may show antagonistic effect of the drug, and the nifedipine and diuretics should not be combined because that may show synergistic effect, that may show additive effect, and hydrolysine should not be combined with prazosin because it may show the synergistic action again, and diltiazem and verapamil should not be combined with beta blocking drugs because it may lead to bradycardia, and methyl dopa and clonidine should not be combined. Hypertension. What is the relation of hypertension in pregnancy? So here, during pregnancy, if a pregnant woman is suffering with hypertension, so no drug is safe in that condition. So proper care have to be taken in order to prevent the hypertensive condition. So here, in the pregnant women, the diuretics, propranolol, ACE inhibitors, and sodium nitroprusside should be avoided. So there are only few drugs which are safer to treat hypertension condition in pregnant women, like hydrolysine, diuretics like hydrolysine, methyl dopa, cardioselective beta blockers, and prazosin. So in beta blockers, non-selectives are not preferred. Only cardioselective drugs are preferred to treat hypertension in pregnant women. So what are the hypertensive emergencies? So here, the cerebrovascular accident or head injury. So if a person is having blood pressure and he is having cerebrovascular injury or head injury, then immediate emergency or care should be taken. And even if in the hypertensive condition, if there is any ventricular fibrillation, person is having hypertension and the ventricles, left ventricle is replaced with the fibrous tissue, then this emergency have to be taken care. And the hypertensive encephalopathy and the angina or myocardial infarction. So in angina or myocardial infarction also there will be raised blood pressure. So this condition has to be lowered. And acute renal failure. So if a person is having blood pressure, then automatically there occurs the impaired renal function also. So this condition have to be taken care. And in pheochromocytoma or cheese reaction and clonidine withdrawal. So in all these conditions, the hypertension has to be given an emergency treatment. The drugs which are used to treat these emergencies are the drug like sodium nitroprusside, which is dose monitoring. So we have to monitor the dose of the sodium nitroprusside, and the drug like GTN, which is used in cardiac surgery and left ventricular fibrillation and myocardial infarction, and the drug like esmolol, which is given in the dose of 0.5 mg per kg bolus, and it is used in reducing the cardiac work. The load on the cardiac tissue can be reduced. And the drugs like phentolamine is used to treat the emergencies like pheochromocytoma, cheese reaction, and clonidine withdrawal. So in all these conditions, these drugs are preferable to treat hypertension. Now let us see what are the drug interactions in dentistry. So if a person concerns a dentist, so what are the drugs which are to be contraindicated, or what drugs interact with what? So these local anesthetics, if they combined with non-selective beta blockers, then it leads to increased local anesthetic toxicity. So that may leads to adverse effect. And epinephrine and non-selective beta blockers should not be combined because that may increase the cardiovascular effects. And on long-term usage of NSAIDs, see, if these antihypertensive drugs are given with NSAIDs, then the antihypertensive effect can be reduced by these drugs. No. The other drugs like the general anesthesia should not be combined with the drugs like angiotensin converting enzyme inhibitors or angiotensin receptor blockers, because that may lead to severe hypotension. And the NSAID drug should not be combined with these angiotensin receptor blockers or angiotensin converting enzyme receptors, because it will not show any effect of these drugs. And the NSAID should not be combined with diuretics, because that may not show these diuretics won't be able to show the activity of hypertension.